My name is Martin Dupuy. I'm neurosurgeon in Toulouse, south of France, and we're going to talk about the water in spine endoscopy. Endoscopy is a hot topic nowadays, and it's a real evolution from our practice, so we have to talk about it. Spine endoscopy may be considered as a water surgery because of a constant irrigation. This irrigation makes the endoscopic technique possible and decrease the local inflammation, septic risk, and blood loss. There's two kinds of irrigation, arthropump or gravity. The question is, what happens to the water at the end of the surgery? In France, the collection bags go to the yellow one and then it burning with a high level of pressure and temperature. The remaining water not used in practice goes in the black bags and then to the compactor. As you can see, the compactors, there's a leakage of fluid going to the ground directly. So we don't have to do this, and we should use the yellow one. To resume, 1 liter of waste water produce near than 1 kilo of carbon equivalent due to the water burning. So the aim of our study was to compare the consumption of water during surgery for lumbar disc herniation in 10 centers in France, Switzerland, and Italy. And we collected data from the kind of surgery, open versus endoscopy, uni or biportal, the water consumption, the operating time, BMI, and the kind of irrigation. The results, more than 600 procedures, less than 20% open procedure. There was no difference between the two groups for the operating time and the BMI. But there is a significant difference between the water consumption because open procedures use 0.1 liter versus 8.8 liters for endoscopy. And if we focus on uni versus biportal, there's also difference, significant difference, 4.3 liters per procedure for uniportal versus 11.2 liters for the biportal. And as you can see, we also notice difference between arthropump and gravity technique for the consumption of water for uni and biportal. To conclude, there's an over-consumption of water during spine endoscopy. It's huge, near 40 times for uniportal and near 100 times for biportal. This over-consumption leads to the increasing of the carbon footprint. As you can see, the numbers are really impressive. We also find that if we use gravity, especially for uniportal technique, we can reduce the footprint by 2.5. So I think, especially for endoscopy, which is maybe the revolution of spine surgery, we need to think about and should improve this consumption of water without modify the quality of the procedure. So we have to think about the parameter of the arthropump and try to use the gravity, especially for uniportal. One other aspect of the reflection will be to reduce the liquid waste. There's a device called Neptune, which is widely used for knee and shoulder arthroscopy. But due to the CSF leak and the prion risk, we do not use this in spine surgery. It's like forbidden. So thank you very much for your attention.